My time in Kakamega has been extraordinary. I've gotten to see firsthand the impact the UHC initiative has had on the ground. But to create lasting health change, governmental buy-in and participation is key. So how is this UHC initiative enabling decision makers to govern with more insight? Today, I'm going to be meeting County Secretary Brenda Makoha to see what she has to say.
Hi.
Hi, my name is Chantal.
How are you?
I'm fine. So Dr. Brenda, I know it's not a silver bullet, but the UHC initiative is really creating buzz among the community. What are the most important insights you found in the data, and what interventions can be made?
With this modern technology, we are now getting real-time data, aggregated data, to make decisions on where we need to prioritize as a county government.
So does this data help you plan your resources?
Yes, more efficiently. We use this in policy directions and budgeting to prioritize where the monies will have the greatest impact in the health system. And because of this, we have actually been able to target health insurance cover so that our poor of the poorest can actually access free treatment in our health facilities on the MTBA platform.
It's really quite the time, and I think we are at the tip of something.
Yes.
Have the laws changed due to the UHC initiative?
Yes, quite. We came up with the community health bill. In this policy, we point out clearly what percentage of our health budget goes to the community health volunteers. The other act we came up with was the Kakamega County Health Act. Revenue that is collected at the health facilities is meant to improve the quality of services rendered at the facility. For instance, we have increased skilled birth attendants and an increase in the immunization uptake in our health facilities. We have come from far. This is a drastic improvement.
Kakamega was incredible. The people I met and the things I saw filled me with so much hope regarding healthcare in Kenya, specifically maternal healthcare, which is something that is very close to my heart. We're going to go to Naivasha and meet a key decision maker, Mr. Gilbert Osoro, to find out how the UHC initiative in Kakamega is impacting on a national level. As the UHC manager at NHIF, I wanted to know what the impact of the UHC initiative has been like for you.
The impact has been phenomenal because when you look at the poverty index in this country, Kakamega ranks among the counties that have a poverty index. And the majority of the people are not in gainful employment and they do not have any form of insurance coverage. When we talk of UHC, it implies that people have access to the needed healthcare services that is accessible, affordable, quality, without being exposed to financial hardship. And for record, 1 million households fall into poverty because of out-of-pocket catastrophic expenditure. We were able, through our partners, to onboard indigent households. We were able to cushion them from out-of-pocket expenditure.
Oh, that's great to hear.
Now, the other thing, the program that we had tremendous impact on the way we administer healthcare in this country, or what I call system change. The use of technology spurred or accelerated digital transformation in NHIF. MTBA was able to remit funds through the virtual money transfer for the indigents that were registered in that particular county. Leveraging on mobile telephony and the technology, it made registration to be so simple.
You talked about a system change, but in order to finance that, you have to have a broad overview. So what value is the UHC initiative adding?
A lot of value. From where we sit, we are able to harness the data. Data is the new oil of the 21st century. From the database, we are seeing the quality of life for the members has improved vastly. The net effect of that program was that about 70% of the population in Kisumu County has access to health insurance coverage, a thing that was not there in the past. UHC is a journey. It is still works in progress. I want to assure you that as we scale up UHC, And as the government anchors in policy and guidelines, we will be able to attain UHC in our lifetime.
Thank you so much, Mr. Osore, for your time.
You are most welcome.
There's much to be done in terms of attaining UHC, particularly for women of reproductive age living within rural and economically deprived areas within our country. But the people, practices, and processes that have come up via and around technology give me so much hope that in my lifetime, my daughter, her daughter, and all women in Kenya will have access to better and quality healthcare.